had significant disasters and significant impacts on the community. We didn't have, from a public health point of view, we didn't have any outbreaks of communicable disease. We did have 53 cases of leptospirosis, mainly in central and southeast Queensland, and 1 case of melioidosis in the post-Yasi cleanup. We had a lot of preventive work going on. We were doing a lot of boil water alerts, 41 for flood and 58 for Cyclone Yasi. But they sort of ensured that we didn't get any increase in gastrointestinal disease. So I think from a public health response point of view, I mean, if you look at the disaster, in its own right, there was an increased loss of life, clearly, and that was an absolute tragedy. I think the numbers were approximately 20 in the Grantham, Brisbane area, mainly through flash flooding. Not necessarily, that was the main cause, and it really happened in a very short period of time. There was 1 death in tropical cyclone Yasi, but that was due to a person who was using a diesel generator in their house because the power had gone down and they asphyxiated. So that's the impact on mortality as far as we can see, though we need to validate that. But here's an impact from our point of view on the public health diseases we were focused on. I don't have the impact on mental health, and I think that's the work that Helen is leading in partnership with Queensland Health, which I think will show the most significant impact, because the impact on people is still being felt in their lives now. So it was successful. Actually, where we did have problems was to do with the volunteer cleanup. This is emergency presentations from Brisbane, where we had an increased admissions for cellulitis. We didn't have, as you can see, we didn't have admissions for gastroenteritis, and we had increased admissions for sunburn and sunstroke. It was a hot day, and a whole lot of people got out there, and it had been cloudy for days and days and days, and sort of like, so the mentality was not there to actually think about taking measures to prevent sunburn or heat stroke. So it's quite interesting. It's sort of like not what you would expect. So from a public health point of view, we did try to warn about some of these things, but it was very difficult given the numbers of people who got out and helped, the thousands of people who got out and helped. So you can see that you have a spike around the post-flood, because the Brisbane flood occurred around the 13th. You have a spike in cellulitis admissions, presentations, sorry. So we were successful, in my view, from a public health point of view. We were successful in identifying the probable risks and allocating resources to do that. But it took every part of the health protection system to do it. Had we had another disaster, there wouldn't have been anyone left. We had to get in, my pool, to do the work. We'd have to bring in other people. Now, we did bring in other environmental health people from other states, and there were more ready to be deployed. We did have to bring in particularly assistance around specialist advice, which is one of the big pressures, is sustaining the specialist advice, particularly around drinking water, that we had to bring in from other states, just literally because staff were falling over. We're going, early in the morning to late in the evening. They just, after 4 or 5 days, you just can't keep going. So you can mitigate a lot of the risks that you talk about in climate change or disasters by a well-organised public health response, but it depends on what you've got available to you. And as I said, there's significant demand on us, and I think we're going to still feel the effect. We're all a bit tired, to say the least, and I can see it popping up now with, people just a little resilience in the workplace, which is something, okay. But also, that's not just about what government does, but it's also what the community can do. One of the vulnerabilities that we did see was that the councils and their investment and profile they gave to public health directly showed up in how much support they needed. If they had a high-profile public health approach and took it was an important issue to them, you'll find that they invested, that they were able to cope a lot better. But there is a risk that public health is not a priority at the local government level and continues to decline. And I think Scott's story about Mosquito control is a case in point. The infrastructure for public health is declining relative to the population growth. I'm not going to deal with the dengue outbreak though, except to say this is some of the numbers that I know Scott was involved, that people had to deal with the cases that occurred in 2009. So you can't take, there's a limit to how much you can take from a public health perspective. So I'm just going to jump through to capacity. In terms of the risks, I think the main risks are in the area of disaster management. Heat is a complex problem for Queensland just because it's hot up here, and it's very strange to talk about heat stroke in Cairns because the temperatures you're talking about in southeast Queensland are a daily event here. So I think we've got to try and come to terms with what heat means in the tropical and subtropical environment. I don't think it quite translates, but disasters and the risks associated with disasters certainly do. We were able to do a good job because we had sufficient trained, skilled people across the wide range of public health issues that we had to deal with. I think some of the challenges will be met by technology, and I think the Wolbachia research is an example to me of how we can mitigate some risks. But sometimes it's also about the ability to have influence and authority. For example, the voice of public health in local government responses, how much it's a priority. How organised is the public health system in dealing with this? If it was lucky that we had 3 disasters in a row by cyclone, we were getting really good at it. You know, we stood up 3 incident management systems 2 weeks after each other, so every time we learned something we applied it to the next, so we're getting really good. But so it takes a lot of organisation, it takes a lot of people to sustain just the communication to be organised so that at the end of the day the Premier is able to stand up and have confidence and speak to the community about exactly what's going on. And finally, our partnerships, our relationships with the partners, the water service providers, the food businesses, the food regulators, local government, other departments, Department of Workplace Health and Safety, Division of Workplace Health and Safety, are all examples of partnerships that we all had to actually work quite seamlessly. And I suppose the challenge for me is a disaster exposes your weakness, and where you've got vulnerabilities, they get cracked open much more under disaster. So the problem for public health in conclusion is that it's often hidden because it's successful, and it's only exposed when you get disasters. So as we deal with this challenge of climate change and capacity, we have to think about how well are we maintaining it between the wars, how well are we maintaining it between disasters, are we recognising that some of these systems that are successful, for example in food safety, need to be maintained. Thank you very much.